Normal pressure hydrocephalus, wet, wacky, wobbly. Wet means urinary incontinence, wacky means dementia, and wet, wacky, wobbly, wacky means dementia, wobbly means you're gonna have ataxia, and as we spoke about, wet is gonna be urinary incontinence. We can of course have some other symptoms, not very important or high yield at all, but I'll just mention them. We can have wide base gait, that's gonna be due to the cerebellum is gonna be compromised, and this is in a patient that adopt a wide base stance to increase the stability and compensate for balance issues. We can have over here depressed affect. So we can have depressed affect, frontal lobe compression, upper motor neuron signs in the lower extremity. So your lower extremities, you're gonna have upper motor neuron signs. Not sure why it's not high yield, so I'm not gonna make a 23-minute discussion about that right now. We can have over here marked improvement in gait with fluid removal. That's Miller-Fisher lab test. Basically, when you decrease CSF, the NPH, it's due to the fact that we can reabsorb CSF by the retinal granulations. If we're removing fluid, that's of course going to make the system much better. We can have enlarged ventricles, the out of proportion brain atrophy on MRI, and ventricular peritoneal shunting. Then we can see where headaches. So headaches are going to be three types of headaches. It's going to be migraine, cluster, and tension headaches. So migraines, guys, remember it's only one side if it's an adult. If it's a children, it can be both sides. But for adult, it's going to be your photophobia, phonophobia, nausea, vomiting, thrombing. We have a mnemonic called POUND. P as in pulsatile, O as in onset, U as in unilateral, N as in nausea, vomiting, D as in disabling. We have a nice question here. What's the initial step for NPH? NPH, when the initial step is we want to do a MRI, CT, MRI venography. If that's clear, then we can go into lumbar puncture. So depending on that, we can do this. Then we can see over here, what I was explaining to you was idiopathic intracranial hypertension. For the next best NPH is doing lumbar puncture. If that improves, then we can go for VP shunting. Okay, it's going to migraines more common in females. It's unilateral. It's usually 4 to 72 hours, so it can be quite long. We have tension type headaches is more common in males. It's going to be onset is doing steep, so it affects one eye. So it's going to lead to ptosis, miosis, anhidrosis, and tearing, lacrimation, rhinorrhea. So behind one eye, it's sharp and steady. And it's sweating. So there's sweating, facial flushing, nasal congestion, lacrimation, pupillary changes. Then we can see tension type, which is going to be a band-like, and this is going to be like around 30 to 7 days, and the tenderness on the head. We have over here there was one 18-year-old girl. She came with headaches in the right temporal region, which only lasts 3 to 4 times a day, and she has mild nausea. So that was like medication-induced headache. Not too important, to be honest. Female over here, female predominant nausea, vomiting. We also mentioned tension, which is like around 30 minutes, 90 minutes, 15 to 90 minutes. This is going to be with pericranial muscle tenderness, male predominance, unilateral trigeminal disturbance, and ipsilateral autonomic symptoms. And 15 to 33 hours, 90 minutes, as I said, improves the oxygen, because when you're going to take in oxygen, it's going to lead to vasoconstriction and it's going to alleviate headache symptoms. Medication we use is going to be developed. It's similar to chronic migraines or tension type, so there's regular medications can change the brain's processing of pain signals and make headaches more likely. So I'm going to make a quick recap. NPH, wet, walkie, wobbly. Wet means urinary incontinence, wacky means dementia, and wobbly means gait ataxia. We can also have depressed mood, and we can have upper motor neurons in lower extremity. You want to do a lumbar puncture here, and treatment is ventricular peritoneal shunting. Guys, migraine here is much more common in the female. It's unilateral, and this is going to be we're going to be around 4 hours, 72 hours. Then we're going to have tension type headaches. Tension type headaches from 15 minutes to 90 minutes, and then which is going to be with your sweating, flushing, nasal congestion, and lacrimation and pupillary changes. Then we can see tension type headaches is going to be 3 minutes to 7 days. Muscle tenderness in the head and neck and the shoulders.